Community diagnosis, also known as need assessment, is one of the very important tools that is used by community health practitioners to oversee the health of the community in which they are serving. So because community practitioners, they live with people in the community, different types of communities, in a rural community, urban communities, semi-urban communities, or specialized communities. So they live with them, they interact with them on a daily basis. It is their duty and mandate to always checkmate to know how far this community has gone in terms of health. So they carry out this assessment to find out what is the actual need of that community. So we're going to look at the steps in conducting community diagnosis in this discussion today. I'm Ezara Royeka. I'm a registered community practitioner. You can do well to get this book. It's one of the best books for community practitioners and other professionals. Community diagnosis is an essential public health and also community health process used to identify the health problems prevalent in a specific population. This specific population, like we said earlier, can be a rural population, can be an urban population, can be specialized populations like the prison community, Christian community, Muslim community, or other special groups. It could be elderly communities or sport community. It involves a systematic assessment. When we say systematic, it has steps, sequential steps that you have to follow in order to ensure, because it's a form of research. So you have to follow systematically from one step to the other, ensuring validity. Validity, because in this community diagnosis, you are going to come up with a community profile. You are going to tell us about the history of the community, the structures found there, the resources, the type of services there, the type of practices, social practices, infrastructures that are found in that particular community. So you're also going to collect data from these people in that community using a scientific-based method, either systematic random sampling technique or random sampling technique, or even any other non-probability sampling technique. So therefore, the sample you are going to use in carrying out this particular study or assessment need to be valid, and there's need for precision. So therefore, you're going to adopt scientific basis, research-wise basis, research-wise protocol. That is why we say it is systematic. So if you have to select 150 persons for assessment in community diagnosis, you should do it in a scientific way using sampling technique to get your sample and ensuring that it is valid. So that is why we say it is a systematic assessment technique to gather information about the health status, needs, and resources of the community. These are the key things there: the health status, the needs, and the resources of the community. So this will help us have an idea of the vulnerability of the community and the strength of the community, and how we can proceed to mobilization of these community members, then their participation and their full involvement in taking over the health of their population. The aim of community diagnosis is to gain insight, to understand the actual health problem affecting that community, their exact nature, and the extent or magnitude of this problem. Okay? So now, identification of health problem, determine what health issues are affecting the community. You're going to identify the health problem. You're also going to determine what health issues are affecting the community. we're trying to look at the component of community diagnosis now. First is identification of health problems. Then determine what health issues are affecting the community. You are going to identify this problem by determining the actual health problem affecting this community. It could be diarrhea, it could be malaria, it could be malnutrition. That is identification of specific health problem. Then the next component is determining the nature of the health problem. And you can only do this when you understand the specific of that identified health problem. Let's say you're talking about malaria here now. You can only say this is the exact nature of what's affecting these people when you are able to tell us the cause of that health problem, the symptom, and the epidemiology. And when we talk about the epidemiology, we are looking at the determinants of that health problem. What are the major issue that is making that health problem to occur in that community? And what is the distribution in terms of person, place, and time? Who is affected? Is it the children? Is it the mothers? Is it the fathers? Is it the elderly ones? Is it the adolescents? That's the person. At what time is this condition common in that community? We're looking at seasonal variations where we are having cholera outbreak, meningitis outbreak, avian influenza outbreak, and all of that. So we also look at time. Then we look at place. Which part of the community is this condition more common? So that is why we say, for you to actually say this is the exact nature of a health problem in that community, you should be able to identify the causes, the symptoms it presents in the person, then the epidemiology, which has to do with the distribution and determinants. And we look at the determinant in terms of the causes, some lifestyle. Is it the lifestyle of the people that is making them to have this condition? Is it the lifestyle of the people? Is it an existing problem in that community? We're going to look at that. Then look at the distribution. Who is affected? Is it the children, infants, adolescents, elderly, pregnant women? Or then look at the time. But in what time of the year does this condition occur more in that community? Then you look at place. Which part of the community is this condition more common? Another component of community diagnosis is relative size of the health problem. At first, we have identified the health problem through scientific processes, through investigation. Then, next is nature of the health problem, which we have looked at by understanding the actual causes, the symptoms, and the epidemiology of the disease or the problem. Then the next component is the relative size of the health problem. So during community diagnosis, community practitioners assess the prevalence or the incidence of the issues in order to understand their impact on community overall health. Let's say community is about 20,000 persons living there and 50,000 is already affected. You find out that the economy in that particular community will be affected because the number of persons who are productive will be reduced because they're already sick, and they will be spending a whole lot of money now to recover back. So that's why we look at the relative size. Who is affected? What's the total number of persons affected? What is the incidence? That is, what is the number of new cases of that disease? What is the existing case of that is known as the prevalence. So when we look at the prevalence, we look at the incidence, we know this condition has a higher chances of clearing the lives of these people in this community and can cripple economic activity in this community. So that's why in the community diagnosis, we look at the identification of the health problem, the nature of the health problem, and the relative size of that health problem. To effectively conduct a community health assessment or diagnosis, you must make entry through the local government into the community. You are going to identify the local government area. Taking, for example, in this particular discussion, we're using Umunoha. which is a community in Imbitoli local government area of Imo State, Nigeria. You have to identify this community in Imbitoli local government area in Imo State. Then you establish a contact with the local government area office. This is important and critical for networking and support. So at the local government area, once you are able to make entry there, the next is for you to visit the local health authority that is being led by the head of the department for health in our own context in Nigeria, or health secretary or health authority secretary, as the name applies. Then when you meet the head of the department for health, there are other assistant head of the department known as a local immunization officer. These local immunization officers have a lot of details of the communities in that LGA, and that will help you have a good idea of that community, their infant mortality, their maternal mortality rate, their population growth projections, the immunization coverage. There are a lot of details and data can be secured from that local immunization officer. And that helps you even to formation. You can even from there get the map of the community before trying to sketch your own. So that is why it is necessary to make entry to the local government area headquarters into that community. Then when you are making entry to the local government authority, you have to prepare. You have to prepare yourself by gathering all the necessary documentations, such as introduction letters, the letters that contain your intention, in order to explain the reason for the visits, to have these metadata stakeholders, such as community leaders, government officials, and local health workers, like we explained earlier. So you're going to prepare your mind, then gather all these tools, meet with these government officials, local health workers, in order to secure these data. The next, you engage with stakeholders because you are making entry. Remember, we are the first step, making entry. Then once you have prepared yourself, the next is to engage with the stakeholders. Upon entering Umunoha, you have to arrange meetings with local leaders, including traditional rulers, community development associations, youth organizations. Then you engage with the stakeholders and ensure that the community is receptive to the study you want to carry out. You have to really explain to them what your intentions are in order to have a good quality data collection. So here, and look at this health worker is having, this is an urban community, having a networking with the stakeholders. The next is identification of boundaries of the community. Remember, you have already acquired a lot of information from the local health authority. Now you also have to make your own boundaries so that you would, once you are done with the study, you can make generalization that this study is only pertinent and inference for this particular community. So that's why you need to go a lot in that community to make sure that you cover the community. Begin by assessing the geographical limits of Umunoha. Umunoha shares borders with other communities, including the Fakala in the north and Awo in the south. In this our scenario we are trying to paint. You have to identify clear physical markers like rivers, roads, and paths, which is essential. You see here now, this is a riverine community, and this health worker is moving one of the local leaders to enable her make a good map of the community. That's why I say utilize local knowledge by consulting community residents, not for them to tell history, because in this community diagnosis, at the end, you are going to have a community profile. And this community profile has the history of the community, the infrastructure, the resources, their details, their statistics, the type of houses you found there, the type of factors that affect health, that can improve health in that particular community. So that is why you need someone from the community to take you along so you can have a robust data collection. Here, this is also a health worker being led by one of the community's members. At the end, you've gathered these data. You now make a sketch map. All the data you've compiled, so that major infrastructure within Umunoha, including roads, rivers, marketplaces, schools, hospitals, and other information you have engaged with the people in the community, you're going to put them in maps. So this is a form of digital map for those in the urban communities who can use the ArcGIS to develop this type of mapping. Then for people in the rural community where network might not permit, you can sketch a map. This is an example of a good map showing all the required information in that particular communities. Make a list of the resources. You have surveyed Umunoha for existing resources, including church, schools, industries, palm oil processing places, local craft, traditional businesses. That is for rural community. But for other specialized communities, you have to be careful about what is found in that community, what can help them. Then you have to state the number of the local markets in Umunoha where these people go for food, because it's also going to be captured in their community profile. Identify churches, mosques, note attendance, and community role. You're also going to list available clinics like the Umunoha Primary Health Care Center. You're going to list it because it is a resources. Labor organizations in Umunoha, including transport union, NGOs like Health for All, or any other youth groups that are engaged in the improving health of the community, like private hospitals and all of that. You have to also list them. You also are going to make a list of cultural practices and attitudes affecting health. You are going to document traditional healing practices in their community. Do they do phlebotics? Did they do traditional bone settling? Did they do herbalist divination and all of that? They have spiritual worshiping and all of that. You are going to note this down. Also, you're going to, because you're going to have discussions, you're going to from there determine the attitude of these people towards modern medicine. You also are going to make research regarding their health care. Do they prefer herbal treatment? Do they believe in more superstitions? Does that affect their health-seeking behavior? These are the things you are going to make note as you continue to make discussions with the people in the community. Then describe social customs and important festivals like masquerades. You are going to explore these customs that affect interactions, kingship structure, extended families, visitation norms. How do those people allow people to visit? How do they treat visitors? What type of rights do they permit in terms of marriage and burial? Are they affecting health? Or are they improving? Or are they new threat? They look at festivals, like major festivals in that community, New Yam festivals, masquerades, and all of that. And what are the important? Do these people hold it? These are things you look at, because it can possibly be one of the things affecting their health. Then you list the infrastructures, such as electricity, whether there's available or outrageous, water supply, whether they have good boreholes, river or well, and what is the sanitation condition. That is why you're going to walk around the community with the help of the community leader. In fact, upon having good discussion with the community leader, they're actually going to assign you someone that will take you around as you move around the community. They look at the transportation, you identify means of transportation, including, is it by road, public buses, or is it a riverine community? Do they have more of boats? You're going to make note of all these infrastructures. You collect these informations from the community because you intend having one, identify the exact nature and magnitude of that problem. That is what is in your mind. Remember what we said earlier. At the end, you are going to come up with, this is the problem of these people. And this is what the community profile, this is what this community is all about. Their history, what is found there, their traditions, their customs, and all of that. Then you scientifically look at them and see, make connections on how this contributing to improvement in health or in deterioration of health. Then you take them into the spreadsheets in your computer and begin analysis. You're also expected to conduct interview surveys with special groups such as women of childbearing age, youth, elders, and all of that. So that is what this community health worker is doing here. It's conducting a group discussion where they will discuss based on what the community is all about, what is happening in the community, their beliefs, their attitudes, their health-seeking behavior, what they have, what they know, and what they don't know. Once you have conducted interviews, because we believe you are expected to formulate questions that focus on health, education, practices, and perceptions, their belief system, what they do, what type of marriage rights, what type of betting rights do they do? Did they prefer traditional bet attendance to skill bet attendance? You have to also going to develop a semi-questionnaires so that to help to enable your group discussion with the community members. At the end, you're going to write a report using Federal Ministry of Health format for our country, Nigeria. The report should follow a standardized format, typically including an introduction, where you're going to talk about what you intend doing, how you, then the community profile, where you're going to tell about the history of the community, the resources, the kinship, the type of marriage found there, the type of activities, festivals, markets, resources available, and infrastructure. That is what is going to be in that introduction. You are coming up with a profile of a community. Then methodology. In the methodology, you're going to discuss scientific means that you use in selection of samples of persons whom you interviewed, whom you had group discussion. How do you come up that, yes, I'm going to interview 500 persons in this community? It should be scientific. And the sampling techniques is important. Then findings. What did you find out using your questionnaires, your group discussion, and your observation? Because these are the skills using community diagnosis. What did you find out? Then after you've gotten the finding, you make a discussion, making reference to other researches that have been done. Then you make recommendations. So that is how the report is expected to be. Then in the aspect of data analysis, because you're going to make data analysis for you to come to conclusion, you're going to present the data collected in tables for demographic, age, sex, level of education, occupation. You're going to do SWOT analysis, your strength, weakness, and all of that. Then you're also going to do a descriptive account of cultural practices because it is a qualitative data. You're also going to use either a digital software to make a descriptive account of cultural practices you found there and all of that. Then in that research reports, you also remember it's going to have citations and references from field survey, what was seen on ground, and any other relevant document that you used in carrying out these studies. At the end, you are expected to give back feedback to the local government, their community, the state and federal minister, because they are going to use this to make plans on how to improve the community and also for community development. Even the community themselves can use that record to make good changes in order to improve their health. That is why you contacted them. So at the end, they expect you to bring a feedback to them. Then your insights, recommendation for health programs. At this point, if you're able to do this, when you now come back to mobilize the community to see where they can comment based on your recommendation, they will be eager to be part to that. Your recommendation, you suggest policies or interventions based on community needs outlined in your report. Then you follow up. Then that follow-up is mobilization. Establish a mechanism for follow-up discussions to address implementation or proposed health interventions. So that is all about how to carry out community diagnosis in a community, which is a very important tool that is used by community health workers to carry out health assessment in a community. And in this discussion, we've been able to look at the important steps necessary for you to carry out community diagnosis in order to identify health problem. That is what is affecting the people in the community. Then we will be able to identify the nature of the health problem, because you're going to understand the specific of the health issues in that community, so that the causes, symptoms, and epidemiology. Then at the end, you also come up with the relative size of the problem, because you're going to assess the prevalence, the incidence of the issue, and the impact it has on the overall health of the community. So community diagnosis is an essential public and community health process used to identify the health problems prevalent in a specific community in order to help the community grow. Do well to buy My Clinical Practice, which is a very important textbook for all healthcare workers.